Hi guys, I'm so sorry. We just had to switch. For some reason, we had some technical difficulties. Apologize about that. Um, okay, so let's get back on to the questions again. I'm gonna have Evelyn help me out for a second.
Mhm.
Okay, guys, sorry, we're back again. We just had some technical difficulties there for a second. So there are many hair products available, and some look ridiculous in the promised hair growth, like chia pet. What are realistic results that a 64-year-old could happen rapid thinning should expect? So it really depends basically upon a couple of factors. So first of all, it depends how much hair you have there. I mean, if you're balding, you're not going to see much results. If you're thinning, then you are probably going to see some good results. Remember, the results are going to vary and it really depends on everyone. So the happy product is a prescription grade product that has finasteride, minoxidil, and retinoic acid, and these are based on clinical studies. So everyone's going to have basically different results, but doing the part, if you're not balding, if you have basically just thinning, you're like an ideal candidate for this product. Also, we also recommend basically taking a multivitamin like vitamin D along with it, because that's also basically going to help the results as well. So again, it really all depends how you look. If you have any questions, you can send us your photos, and I could do a better evaluation and let you know. Can I apply hair creams or gel for styling while using Happy Head? Yes, you can. How much time between the application and the styling gel? Just let the hair dry a little bit for a minute or two, and then you can apply the hair gel right away. I'm gonna go back to one of the questions that someone asked early on before we got cut off. So basically, week two, applying the serum morning and night. Am I doing this correctly? The answer is yes, you are doing it correctly. Apply 1 ml in the morning, 1 ml at night, and realistically, you have to do it for about 4 to 6 months to see results. I've noticed some improvements after 7 months. Will I continue to improve? Yes. See, again, everyone's different. We typically say 4 to 6 months. That's kind of like the minimum you kind of need to do it basically to see best results. But I have patients that actually in my own personal clinic that continue to see results even beyond the 6 months. So everyone's different. But yes, if you're getting improvement by the 7 months, please continue to do it. Um, and you're probably going to see even better results for doing it longer. I'll be starting oral. Oh, here somebody asked. I will be starting oral minoxidil finasteride next week. Is that better than topical? Again, everyone's different. Obviously, when you take something orally, you're exposing your body to more side effects, but you're probably going to see similar results. There are some patients that are on oral finasteride and don't see improvements, and then they add topical happy, and all of a sudden they see like really good improvements. This is what we call sandwiching. You're doing it from the top and from the inside. So let's say if you do the minoxidil finasteride for 4 to 6 months orally and you're not seeing results, then you could actually start applying Happy Head, and you're probably going to see better results. So if you do topical and oral together, you will see better results. Hello, doctor. Is it okay if I apply 2 ml once a day as opposed to 1 ml twice a day? So, I mean, it is. Some patients might have a little more irritation doing that. This is why we try to break it up. But as long as you're not having irritation and no side effects, you're fine doing that. My question is on the amount of use per session. In your video, you described doing a zero point 0.5 ml on the back and a zero point 0.5 ml on the front of your head. If you have general thinning throughout, my thinking is, would you want to add additional zero point 0.5 to cover all over? No, no, just do zero point 0.5 ml kind of in the general front area and zero point 0.5 ml in the general back area. We try not to use more than 1 ml at a time. The problem is that you're just going to increase your risk of side effects. Now, it's possible that you could do it and you might not have any side effects, but we generally try to recommend 1 ml morning and night. It seems after many surgeries I've had in the past 4 years, I'm thinning out on top of my head. Any suggestions? Yes, use the topical happy head. Do it for about 4 to 6 months. If that doesn't work, you can also add oral finasteride or oral minoxidil and see if you're going to get better results. The problem with doing a hair transplant is that the transplanted hair, for the most part, they're going to remain there, but you're still going to continue to thin out, with other hairs. That's the problem. So that's why you still have to do other stuff to prevent the thinning. So I'm reading the next question. Um, with that one, we already answered. Okay. I just started using this product about 2 weeks ago. I'm putting it in the morning and night, zero point 0.5, like you suggested. Will the hair grow on my forehead where I've lost majority of my hair? Well, here's the thing. If you're really losing a lot of hair here, then apply the entire ml right in the front. That means you do a zero point 0.5 on the left and zero point 0.5 on the right, and you're just going to rub it in. Give it 4 to 6 months, and please take photos monthly. If you don't take photos, you're not going to see your progress. I have a question about the expiration date. The Aquas formula or the regular one, is it still good past beyond the date or just less effective? Either just applying 1 ml once a day, so I'm not using them as fast as your subscription, is the reason the Aquas formula expires quickly. So by FDA law, we have to put expiration dates on our product. The Aquas formula, by FDA law, since it has water in it, it can only have a 30-day expiration. Now, it doesn't mean that by the 31st day, the entire thing expires. Possibly it could be less effective. So our recommendation is that you could still use it beyond the expiration date. I mean, I wouldn't wait 6 months beyond the expiration date to use it, but you guys could still use it. And honestly, I don't think it's going to really affect the efficacy much. But legally, we have to put those on the bottom. How often should I be using a dermal roller, and should I avoid using happy head after use? So typically our recommendation is that apply happy head and dermal roll gently. If you could dermal roll every night, that would be great. Our recommendation is 0.25. I was talking to a patient this morning, and he was using the 1.5 because he has read that on the internet. And basically, it said on the internet, Dr. Google, that the 1.5 is really what you need to penetrate. The problem with the 1.5 is that one, it hurts a lot. Two, it's gonna make you bleed. And number three, most people can't tolerate it. We've seen amazing results by just using a lower depth 0.25. So my recommendation is use the 0.25 depth and try to do it more frequently, as opposed to the 1.5 where you only have to do it once a week. Finasteride is usually prescribed after hair transplant. Can happy topical minoxidil be used instead of the pill? Absolutely, yes. We have a lot of hair transplant patients in our office that do this product after hair transplant. So basically, that means they use the happy head after to get hair transplant, but you have to wait about 6 weeks to use it. See, the problem with the hair transplant is that you're only doing transplant in a certain area of your scalp. You're not doing transplant everywhere. So you're still gonna lose some hair everywhere else. So the happy head will prevent the hair loss in the other areas of your scalp where you didn't have the transplant. Again, I've noticed some improvements after 7 months. Will this continue to improve more? Yes, it can. Please continue to use it. How often should I be using a dermal roller? Try to use it every night if you can. That would be ideal. Try to get a 0.25 dermal roller. Is this product safe for patients with high blood pressure? So minoxidil, the topical minoxidil, well, oral minoxidil was used for patients with high blood pressure. It lowers the blood pressure. So if you already have high blood pressure, the product will actually be beneficial for you. But topical minoxidil shouldn't really alter your blood pressure that much. So yes, it should be safe. What are the types of alopecia for men and for women? Which are not receptive to treatment? Great question. So there are many different type of hair loss, what we call alopecia. So alopecia is a generic name for hair loss. So there is androgenetic alopecia, what we call male and female pattern thinning. There's alopecia areata, where it's an autoimmune condition where people get bald patches, and there is also cicatricial alopecia, which is scarring type of hair loss, which typically happens more like in darker skin individuals. Happy is intended to be used for patients with male and female pattern thinning. For patients with scarring hair loss, known as secretial alopecia or alopecia areata, this product is probably not going to help you. Recently, there was a study that showed that if you apply topical minoxidil for patients with alopecia areata along with a derma roller, that it may help. So some patients do use Happy for alopecia areata. Again, we're not recommending it, but if you do want to use it, we're not preventing you from using it, but just know that it may not help. Can you talk about sun sensitivity while using Happy Ed? What if I'm the sun a lot on the weekends, like going to the gym? Do you recommend getting the product without retinol? Yeah, so retinol will increase your sensitivity to the sun. If you feel you're going to be out in the sun a lot, just get the product without retinol. How does Happy determine if I'm a good candidate? So the way it happens is that you take a photo and you send it to a doctor's, and a doctor will evaluate you. Um, and if you are a candidate, will prescribe the medication. If you're not a candidate, will not prescribe you the medication. Uh, if you're not sure, you can always send the photo to our help desk. It's help at Happy Ed, and they will send the photo over to me, and I'll let you know if you're a good candidate or not. So send us the photos, guys. Will this work for hair loss from hair pulling? Well, it depends. I mean, if you have pulled all the roots out, then the answer is no. But if the roots are still there, then it could help you. Generally, it does. So one of the patients said, so 1 ml in total twice a day. Yeah, so you're gonna do a 1 ml in the morning and 1 ml at night. So that's 2 mLs total per day. Is it expected to have some shedding when starting Happy Head with the minoxidil? Yes, minoxidil could cause some shedding in the first 6 to 8 weeks, and that is normal. In fact, patients that get the shedding initially could have much better results down the line because it is resetting your hair cycle. Again, it typically lasts about 6 to 8 weeks. If I stop using treatment, will the hair fall out? That's a great question. So, you see, one of the main reasons why people lose hair is because of testosterone in your body. And that testosterone is always trying to miniaturize your hair and cause hair to fall out. When you go on Happy Head or even on oral minoxidil or finasteride, you are fighting that war. That means you're combating the effects of testosterone on your hair. So once you stop all these hair loss treatments, guess what's gonna win? Your testosterone, because you're not changing your testosterone level. So yes. So the answer is that if you stop any hair loss treatment, your hair is gonna fall out.
How long would you say it lasts? Would it still give you the full hair cycle, or
Yeah, I mean, it depends. I mean, look, you're typically with oral finasteride, if you stop the medication, you're not going to experience any hair loss for another 3 to 6 months. So yeah, it's probably going to give you some time before you start shedding again. If I pluck gray hairs out, why do they keep growing back? Because that hair follicle has turned gray. The hair follicle has turned gray. So when you pluck the hair out, you still have the hair follicle there. So it's going to continue to grow more gray hairs. Great question. What is recommended to take? Why? When is it recommended to take breaks? Will it negatively affect results? Some patients do take some time off here and there to give their scalp a break. It usually should not affect the results. I mean, it depends how long of a break you take. If it's just for a few weeks, no problem. If you take it for 6 months, yeah, you're gonna lose all the results. Is there age limit for the product to work? No, there's really no age limit, but it really depends on how you look. Again, I just saw a photo this morning of a patient who was completely bald in the crown area. Well, Happy Head is not going to work for your crown because there are no hairs there to grow back. But if you're thinning in the front, then the product basically could work very well. So, so so it really depends on how much hair you've lost and in what stage of hair loss you're at. Can I cure graying? So there's no cure for graying or hair loss. However, Happy Head is and will come out with a gray hair formula soon. Dr. Sean and I, we have been working on it for the past 4 to 6 months secretively. So we're excited about it. Um, we're about to release it soon, but not yet. And it's very different than all the other gray hair formulas out there. It's based on clinical studies. How do I maintain results without continuing to increase the dose? Well, you don't have to increase the dose. So initially, a lot of patients use the product twice a day for the first 4 to 6 months. If you like, after 6 months, you could go down to once a day. And sometimes it may maintain the results, or still do twice a day, but maybe do it like 3 to 4 times a week. If I haven't seen results in 3 months, do I continue with the same dose for 6 months, or can I increase the dose? So, if you understand the formula, uh, I mean, that is pretty much our strongest dose for now. I know we are coming out with a finasteride 0.3%, but I don't think it's officially out yet. 3 months is still a little bit early. I would probably honestly give about 4 to 6 months. Also, please take photos. That's really important to track your progress. You will not believe the number of times every day patients come in with a full set of hair and they're telling me that they see no results from Happy Head. And then I compare the before and after photos and they cannot believe the results. So please take photos from the top, from the front, from the side. Tracking your progress monthly is a really important thing. Does your company sell the rollers and inform us how to use it? Yes, we have the derma roller. In fact, you probably get one for free with your order, and there are instructions on how to use it on the box. So when you place your order, just ask for derma roller and we ship you one. Does skimming the product for a couple of days affect the results? Typically, no. But if you skim for a few months, it will definitely affect the results. Yes.
Okay, and the next question is basically to avoid side effects, we recommend titrating.
Yes.
Can you explain what that means?
Yes, touching up. So what it means that week one only use it once a day for like the first week or two, and then after that you're gonna go to twice a day. If you're super sensitive, what you could do, you could instead of using 1 ml once a day in that first week, you could use half ml once a day for the first week, and then go up to a full ml once a day for the second week, and then go up to twice a day basically on the third week. Touch it up slowly. There are no real rules, and so whatever you wish you could do. Will I need to be on the hair loss treatment forever? So that's a great question. So again, as I said earlier, unfortunately, there's no cure for hair loss yet. So once you start treatment, you do have to be on it for as long as you want to see the results. Thank you so much for that question. And guys, sorry about earlier on. We had some technical difficulty. We're going in and out. And a couple things. Derma roll is very important. I want you to start doing the derma rolling basically as you use the product, and try to use the product, consistently. How long should I wait to add oral minoxidil or finasteride? How do I know which one I need? So, first of all, you should use the product, that happy product, for about 4 to 6 months. Number two, reach out to us, and your doctor will decide which one you need. It really depends on if you're afraid of the sexual side effects of finasteride or not. If you're not afraid of it, then you could start doing the oral finasteride. If you're afraid of it, then we'll put you on oral minoxidil. I think, in my opinion, they both work quite effectively. Again, we may be coming out with a pill that contains both finasteride and minoxidil all in one pill. That should come out soon. So, we'll tell you more about it. Will hair shedding still happen with oral medication? Typically, with oral minoxidil, the hair shedding is unusual. For women, what dose do you recommend starting at? If you're talking about, well, it depends what you're talking about. If you're talking about the topical finasteride, if you're a female above age 50, you could start with the standard formula of 0.25 topical finasteride. If you're talking about the oral minoxidil medication, I would start with a quarter of a tablet for 2 weeks and then go to half a tablet after that.
Okay, this next question isn't necessarily like hair thinning as hair loss, but like if your hair is just naturally very thin, is there anything that can help? Does Happy Head have a product?
Yeah, it's possible. Look, it's possible that if you just have like you just have natural thinning hair, that doing Happy Head will thicken your hair. Yes. Now, if you had always thicker hair and you've thinned out, Happy Head will definitely help you. So it really depends on how you're going to respond, and unfortunately, results varies. So it's possible that one patient may thicken their hair and the other patient may not. So you're not going to know until you try the product for 4 to 6 months. Can I go into sunlight immediately after applying the serum? Yeah, I mean, typically, yes. And remember, the retinol could make your scalp a little bit sensitive, but if you feel you're burning, I would probably stay out of the sun over a hat. And if you're really sensitive, let us know. We'll take the retinol out. If after a year I see my hair has grown to a point that I'm satisfied, can I stop the product? Well, the problem is that if you stop the product, you're going to lose all that benefit. So my answer is no, do not stop. You could cut down a little bit and maybe use it 3 to 4 times a week, but I will not stop the product. Is biotin beneficial? What about caffeine? Biotin and caffeine basically could help. That's why I recommend just taking a regular multivitamin. Um, and I think our multivitamin has caffeine in it, I believe. Does stress and diet have a major contribution to thinning? Absolutely, yes. Stress will definitely make you lose your hair for sure, and will basically cause hair loss. A diet, yes, being on a bad diet will definitely cause more hair loss, and that includes, for example, like having a lot of whey protein isolates. These are these pre and post workout shakes, energy drinks, being on testosterone, DHEAs, a lot of MSGs. Yes, bad diet will lead to bad hairdos. What happened? Oh, what?
Any foods to
I think I lost for some reason. I mean, I just.
Okay. I think the last question was any foods to definitely avoid to promote hair growth, regrowth.
Any foods
To avoid. I
to
guess you
avoid.
mentioned.
Again, avoid testosterone. Um, yeah, avoid testosterone and DHEAs, MSGs, and also pre and post workout shakes that are whey protein isolates. Those are bad for you.
Okay. I think that's all we have time for today.
All right, guys. Well, thank you so much. Thank you for joining us on another AMA session. Sorry for all the technical difficulties. Thank you so much for Evelyn, who basically is here every week trying to get everything together. And thank you for Eric, our VP of Operations, who makes sure that I show up and do all these AMAs with you guys. Thank you, everyone. Have a beautiful day. Bye.